You've probably met a lot of doctors in your life, maybe a lot of female doctors. This might be hard to believe, but did you know that medicine before is a male-dominated field?
That is correct. Apparently, back in the 1830s, there were a lot of things that females couldn't do, since they were expected to become wives and mothers, or maybe teachers or seamstresses.
The classic patriarchal ideology amounting to gender role stereotypes. I see. So, being a doctor is definitely not one of the options for a female. With that, have you ever wondered who the first female doctor is?
That would be Elizabeth Blackwell, the first female who received a medical degree in the United States.
Interesting. So who exactly is Elizabeth Blackwell?
In Bristol, England, Elizabeth Blackwell was born, and little did everyone know she was a force to be reckoned with. She grew up in a socially aware household and was exposed to abolitionist work in an early age, and took part in discussions on women's rights, slavery, and child labor with her family.
A strong-willed lass who never wished to be more than an educator was invigorated by a friend who had cancer to pursue medicine with hopes that a female doctor could treat her condition with compassion and sympathy.
In a patriarchal society, it is difficult for women to be seen and recognized. She was rejected from 12 different medical schools due to the thinking that either women are intellectually inferior or she was seen as a threat, proving women are as capable as men. It was an uphill battle just for Elizabeth to be accepted in Geneva Medical College, and it took 150 young male students who unanimously voted for her to be accepted in the program.
Despite this small victory, little did she know that she had more battles to face as she went along med school. Right after her graduation, Elizabeth continued her training at London and Paris hospitals. In the early 1850s, she returned to the United States. In 1857, she opened a small clinic which later became the New York Infirmary for Indigent Women and Children, now known as the New York Presbyterian Lower Manhattan Hospital.
Elizabeth and her staff, who were entirely female, provided medical and surgical care for poor families. She emphasized the importance of preventive care and personal hygiene, since she observed that epidemics are often caused by male doctors who fail to wash their hands between patients.
During the American Civil War in 1861, she helped organize the Women's Central Association of Relief and the U.S. Sanitary Commission, approved by President Abraham Lincoln, where she trained nurses for Union hospitals.
In November 1868, Elizabeth was able to open a medical school, the Women's Medical College of New York Infirmary, devoted to educating and training future female physicians. She served in the Women's Medical College by being the chair of hygiene and ensured that the institution had prime standards in every aspect. A year after, Elizabeth returned permanently to London and served the London School of Medicine for Women up until 1907. She became a professor there and taught gynecology.
Aside from being a practicing physician and professor, Elizabeth Blackwell also wrote lectures and essays such as The Loss of Life, with special reference to the physical education of girls, The Religion of Health, her autobiographical pioneer work in opening the medical profession to women, and essays in medical sociology.
Seems like Elizabeth Blackwell is a well-accomplished physician despite everything she had to go through, that even in her final years, she was still relatively active with her advocacy and being involved in various social reform movements.
On the 31st May of 1910, Blackwell died from a stroke in her beloved home in Hastings, Sussex. Our dear Elizabeth Blackwell is buried in St. Mons Parish Church located in Scotland.
Women, despite the same amount of workload as men, often have no decision-making power over credit and are poorly represented. While we acknowledge that prejudice against women is less common nowadays, it remains ingrained in our thoughts how such traits remain as fixed dispositions, which should not be the case.
So before putting an end to this discussion, is Elizabeth Blackwell considered a hero?
As chair of hygiene at the Women's Medical College, she was able to provide proper medical education to females who later became competent female physicians.
Also, because of her, women can now enter medical school without having to go through a more difficult process than men.
Blackwell persisted despite the discrimination against women and was able to create a safe space and opportunities for women in medicine, which resulted in women holding various positions in the field of medicine.
And two, by setting up various health establishments to provide job positions to women and treatment to the poor, and so much more.
Because of what Elizabeth Blackwell did and how she fought for the rights of women over everyone else who was discriminated against, she has come to be regarded as the pioneer of women empowerment, making her the paragon of the word hero.